She cooks dinner for the other residents each night. A is experiencing delirium. B has a disorder of affect. C is confabulating. D is experiencing echolalia. C is confabulating. The most important aspect in the care of a patient who is at risk for suicide is A. Identifying the patient's plan. B. Eliciting the help of family members. C. Acknowledging the patient's feelings. D. Never leaving the patient alone. D. Never leaving the patient alone. A small percentage of clinically depressed patients, A. complain of persistent anorexia. B. experience guilt and self-reproach. C. have pervasive thoughts of suicide. D. may report an increased appetite. D. may report an increased appetite. Disorders of thinking include all of the following: EXCEPT, delusions. B. phobias. C. anxiety. D. obsessions. C. anxiety. A patient who is taking Aventil, A. is usually hospitalized for debilitating, chronic depression. B. may have nonspecific T-wave changes on the ECG. C. can safely take an MAOI drug at the same time. D. responds better than he or she will respond to treatment with a tricyclic antidepressant. B. may have nonspecific T-wave changes on the ECG. Commonly used antidepressants include all of the following: EXCEPT, H. Alexa, B. Xanax, C. Paxil, D. Zoloft. B. Xanax. When evaluating a patient with a behavioral emergency, virtually all of the diagnostic information you obtain must come from A. your conversation with the patient. B. the patient's family members. C. the patient's general mood and affect. D. the medical history. A. your conversation with the patient. Klonopin and Buspar, block the reuptake of serotonin. B. are both benzodiazepines. C. are used to control seizures. D. are anxiolytic medications. D. are anxiolytic medications. C. administer 25 to 50 mg of diphenhydramine. I use words such as how and what whenever possible. B. they might put ideas into the patient's head. D. ensure that you have a route for rapid egress, and visually scan the patient for potential weapons. Which of the following words would most likely de-escalate the symptoms of a panic attack to a more manageable level? A. care. B. help. C. relax. D. safe. D. safe. When extreme anxiety occurs in conjunction with restlessness, a patient, A. is not distractible. B. often becomes suicidal. C. presents with a flat affect. D. becomes agitated. D. becomes agitated. Which of the following is not an identified risk factor for suicide? A. Hispanic woman older than 55 years of age. B. a sudden improvement in depression. C. recent loss of a significant relationship. D. financial setback or loss of a job. A. Hispanic woman older than 55 years of age. In anxiety disorders, the dominant moods are A. confusion and apathy. B. euphoria and elation. C. anger and agitation. D. fear and apprehension. D. Fear and apprehension. Which of the following conditions has been associated with death following exposure to a taser device? A. Excited delirium. B. Spinal cord injury. C. Electrocution injury. D. Rhabdomyolysis. A. Excited delirium. D. You appear to be very sad. A state of delusion in which a person is out of touch with reality is most appropriately termed as psychosis. B. Tangential thinking. C. Derealization. D. Schizophrenia. As psychosis. B. Patients are often hesitant to answer direct questions regarding hallucinations or illusions. The belief that thoughts are being thrust into his or her mind by another person. Venlafaxine is the generic name for A. Lexapro. B. Neurontin. C. Effexor. D. Librium. C. Effexor. A exists when a person's abnormal behavior threatens the safety and well-being of himself or herself or others. Accelerated thinking, in which the mind skips very rapidly from one thought to the next, is called a perseveration. B. Circumstantial thinking. C. Confabulation. D. Flight of ideas. D. Flight of ideas. C. Experiences intolerable anxiety and autonomic symptoms. Metabolic causes of abnormal behavior include a thyroid hyperfunction. B. Amphetamine toxicity. C. Diabetic ketoacidosis. D. Vitamin deficiencies. C. Diabetic ketoacidosis. D. Safely transport him to the hospital and monitor his behavior en route. Patients who alternate between mania and depression, A. have multiple personalities. B. are referred to as bipolar. C. present with a flat affect. D. have a history of schizophrenia. B. are referred to as bipolar. Which of the following is not a general guideline to follow in caring for a patient with a psychiatric problem? A. Remain confident in your abilities. B. Be indirect when possible. C. Provide honest reassurance. D. Maintain a non-judgmental attitude. B. Be indirect when possible. At a minimum, you should be able to assess an emotionally disturbed patient's A. general appearance. B. ability to recall. C. blood pressure. D. blood sugar level. A general appearance. Psychomotor abnormalities associated with depression include A. agitation and pacing. B. flat affect. C. distractibility. D. fatigue and insomnia. A. agitation and pacing. A patient who is confused, A. has an impaired understanding of his or her surroundings. B. should be given 50% dextrose to rule out hypoglycemia. C. can usually be redirected by providing emotional support. D. cannot recall the events that preceded his or her illness. A. has an impaired understanding of his or her surroundings. People who are overly concerned with their physical health and appearance most likely have a dissociative disorder. B. somatoform disorder. C. Compulsive disorder. D. Personality disorder. B. Somatoform disorder. A. Experiences weight loss that may cause poor health or even death. B. Assess the potential for violence on every EMS call. Which of the following conditions would be the least likely to produce psychotic symptoms? A. Hyperglycemia below cardiac output. C. Temporal lobe seizures. D. Closed head injury. A. Hyperglycemia. An agitated man with an antisocial personality. A. Is at highest risk for suicidal behavior. B. May be demanding and dictate your care. C. Will not think twice about hurting you. D. Has a morbid fear of crowded environments. C. Will not think twice about hurting you. A. Avoid arguing about the patient's misperception. Which of the following drugs is an MAOI? A. Seneca and B. Pomelo. C. Parnate. D. Laval. C. Parnate. Repetitive actions that are carried out to relieve the anxiety of obsessive thoughts are called A. Compulsions. B. Perseverations. C. Confabulations. D. Stereotyped movements. A. Compulsions. Which of the following steps of caring for a patient with a psychiatric emergency would most likely give the patient the feeling that something is being done to help? A. Remaining calm and confident. B. Asking direct questions. C. Encouraging the patient to talk. D. Developing a definite plan. D. Developing a definite plan. D. A paramedic whose son was struck and killed by a car becomes acutely anxious upon arriving at the scene of a motor vehicle versus pedestrian incident. A psychotic episode most often leads to violence because of A. The patient's family's reaction. B. Overreaction of the paramedic. C. The influence of an illicit drug. D. Exaggerated fear or paranoia. D. Exaggerated fear or paranoia. C. Caused by a physical illness or the influence of a substance that interferes with normal cerebral function. When assessing a patient with a behavioral emergency, the most important assessment tool you have is A. Your mind. B. A glucometer. C. A pen light. D. Cardiac monitoring. A. Your mind. Most psychotropic medications exert their therapeutic effects by A. Enhancing the effects of the thyroid gland. B. Targeting the autonomic nervous system. C. Suppressing cerebellar function. D. Inhibiting endocrine function. B. Targeting the autonomic nervous system. A. Continue to talk to the patient and monitor his peripheral circulation. C. Assess her oxygen saturation and blood glucose level. When painful memories are repressed, blank is impaired. A. Recall. B. Retention. C. Registration. D. Recognition. A. Recall. D. What medication did you take? B. Represents a person's effort to adapt to internal or external stress. B. Muscle spasms of the neck, face, and back within a few days of starting treatment with an antipsychotic drug. Side effects of MAOI antidepressants include A. Hypersomnia, B. Suicidal behavior, C. Orthostatic hypotension, D. Acute bradycardia. C. Orthostatic hypotension. D is characterized by acute global impairment of cognitive function. A person who is neologistic, repeats what he or she hears. B has accelerated or pressured speech. C invents words. D talks with grossly slurred speech. C invents words. When a person has a personality disorder, a medication therapy generally is not indicated. B. Another psychiatric illness typically is present. C. The disorder most often stems from fear. D. The paramedic can influence the patient easily. B. Another psychiatric illness typically is present. D. A person with mental retardation has a disorder of intelligence. C. The typical onset of schizophrenia occurs during early adulthood. Which of the following assessment findings is MOST suggestive of an organic cause of abnormal behavior? A. Multiple tattoos. B. Auditory hallucination. C. Skin that is cool and dry. D. Unusual breath odor. D. Unusual breath odor. Many EMS personnel may experience a lack of confidence in their ability to deal with emotional disturbances for all of the following reasons, except the uncontrollable fear of personal injury, abnormal behavior that stems from a psychosocial etiology would MOST likely occur in a patient who experienced emotional trauma as a child. A man who smiles pleasantly when he tells you of the recent death of his wife. Has an inappropriate affect. Disorganization and disorientation are ways that certain psychiatric conditions may present themselves. Generalized anxiety disorder is characterized by persistent and unproductive worrying. Which of the following statements about panic disorder is correct? Panic disorder is characterized by sudden, unexpected fear and dread. Common signs and symptoms of a panic attack: a prolonged loss of consciousness. When caring for a patient who is experiencing a panic attack, your manner must convey that everything is under control. Any patient who is experiencing a panic attack should be evaluated to rule out an underlying medical condition. Signs and symptoms of depression that last for at least 2 years are highly suggestive of dysthymic disorder. Which of the following questions would be the MOST appropriate initial question to ask when broaching the subject of suicide with a depressed patient? Have you ever thought that life wasn't worth living? Manic patients may report that their thoughts are racing, and they may rapidly skip from one topic to another. This is called tangential thinking. A hallmark sign of mania is marked hyperactivity. In hypochondriasis, patients have significant anxiety or fear that they may have a serious disease. An alteration in one's perception of reality is most characteristic of a dissociative disorder. The best example of an impulse-controlled disorder is pathologic gambling. If a psychotic person's level of consciousness is fluctuating, you should suspect an organic brain syndrome. When caring for a patient experiencing a psychotic episode, you should first assess the situation for danger. Coaching her to slow her breathing, monitoring her oxygen saturation and end-tidal carbon dioxide levels, administering supplemental oxygen, assessing her cardiac rhythm, establishing vascular access.